and welcome to the Intentional Living with Emla podcast. Today, I am beyond excited to welcome Dr. Pragna Patel, one of my wonderful friends, and a board-certified OBGYN, as well as a Menopause Society certified practitioner. I'm sure when you just heard Menopause Society certified practitioner, you're like, that's exactly what I was telling my friends. I'm like, today I'm talking with Dr. Pragna Patel, and that's what her title is. So
Yes.
Tell us a little bit more about yourself.
Sure. So I live here in Dublin. I have a wonderful husband who is a dentist. I have 3 amazing children. I have a 10-year-old son, an
Yes.
8-year-old daughter, and a soon-to-be 3-year-old daughter.
So you're a busy mama.
Busy mom. I'm in my mid-40s, so I'm in midlife, like I'm sure most of your listeners
Almost.
are, especially pertaining to today's topic.
Yes.
And I am, I've worked in various roles as an OBGYN, and my career has sort of evolved. And now I am opening my own telemedicine and in-person practice, focusing on perimenopause, menopause, and all things that pertain to midlife women.
She said she's opening her practice,
Yes.
and her focus is going to be perimenopause, menopause, and all things pertaining to women. This sounds exciting to me, and this is what
Yeah.
we need. So today I have a ton of questions for you. I don't know if one episode is going to be enough for this, but I'm just going to jump right in. Are you okay with that?
Yes, absolutely.
So we just hear, right now it's a buzzword, menopause, perimenopause. Just what is the difference between menopause and perimenopause?
Sure. So menopause technically is going to be 12 months in a row without a period. So that's the textbook definition.
Okay.
And then perimenopause is technically that transition period leading up to that
Okay.
12 months in a row after that final period. So again, once you've had that final period, you have to go 12 months. And at that point, we would say you've entered menopause.
So tell me about the ages again for perimenopause. What are the average ages for menopause? And tell me who should be expecting and who should be worried or thinking about it.
Sure. So the average age of menopause in this country is around 51, 52. But with that, there's such a wide range. So about 90% of women will enter menopause between the ages of 45 to 55. And I've even seen patients in their late 50s still having periods. So there's still a wide range of what's considered normal. And then perimenopause, which is that transition period, can start anywhere from a couple years before that final period, or worst case scenario, 10 years before that final period. So if we're considering maybe 45 is the youngest age and we backtrack 10 years, I mean, that takes us to 35. So you can actually start seeing symptoms of perimenopause in your mid 30s. So it's not surprising that women may, as they're kind of entering this phase or their periods are spacing out, if they kind of think and backtrack, sometimes they're kind of surprised as to maybe some of their first symptoms did appear in their mid to late 30s, but menopause wasn't even on their radar. You think, gosh, that's something that's going to happen in my 50s. But it can really start that early for some women.
Well, I love listening to you over the years, getting to know you more. There's something that strikes me about you. You make it part of life, and that's why I really invited you to this podcast, because you embody intentional living. And when people talk about menopause, when we read about it, when we watch videos about it, it's this, scary thing, and that we should all look forward to this doom. It's, we're going downhill, wait till it hits you, and that's, but you have that mindset of, let's embrace it, like, this is menopause, this is perimenopause, let's do this. And with that, I think about the symptoms being different for every woman. Tell us some of those symptoms and kind of what we should be expecting.
Yes, absolutely.
Yeah.
I love your sentiment of that we shouldn't be fearing menopause, but it's inevitable. It's going to happen to all of us, all women.
Okay.
It will happen. And I think being prepared and being knowledgeable about this topic can really go a long way.
Yes.
So some of the first symptoms, honestly, the first is probably changes with your period. So,
Okay.
and again, there are no rules. So your periods can become irregular in many different ways. As far as timing, they can be maybe subtly a few days closer together. Maybe they're spacing out. Maybe they're a little bit heavier. That's not uncommon, where women are like, oh my gosh, like it's like a murder scene or the floodgates have opened. So you can have these, rushes of bleeding. On the opposite end, you could have less bleeding. You could have more PMS symptoms. They could last longer. So really, there are no rules, but usually a change in your established periods. And I would say most women, 20s, 30s, they're sort of in a pattern and they kind of know what to expect. And so whenever there's a deviation or a change, that's usually one of the first signs of perimenopause. And then again, the symptoms vary for women. So sometimes women will start with classic hot flashes, night sweats, problems with sleep. But there is you could Google perimenopause symptoms and you could get lists anywhere from 30 to 60 symptoms long. So
Yes.
mood changes,
Hair loss, all the things.
worsening depression, anxiety, weight gain, inability to lose weight or maintain your weight, headaches, breast changes, skin changes, hair changes. We talk about brain fog, just not feeling as sharp as we used to be, name recall, word recall, or we walk into a room and you're like, why did I come into this room? And so there's so many symptoms, and really affects all women differently. Not all women experience all symptoms, but to a varying degree, I would argue probably every woman at least experiences one. And
Yes.
so, those are some of the things to kind of be on the lookout for.
That's very enlightening, to be able to see that some of these symptoms of menopause are just some of the basic things that happen to us. Even they overlap with a lot of symptoms of other disease states, like
Yes.
other chronic disease states that existed prior to menopause.
Correct. I mean, some of them are so vague, like fatigue,
Yeah.
headaches. And some things women in their midlife, so like 30s, 40s, we're really busy. We're raising families. We may have partners, aging parents, work, maintaining positive social connections and having time for ourselves. So a lot of times we just think, oh, I'm not sleeping because I'm stressed, or I'm losing hair because I'm stressed, or, I haven't been eating well. I haven't been sleeping well. And so a lot of times it's hard to distinguish. And what I believe really in life, it's probably a combination of things. So yes,
is.
stress is a huge component, but I think also hormonally, we need to recognize that these shifts are happening and that they can also impact the symptoms that we're having.
That makes so much sense. So, but from a perspective of, okay, this is new to me, or I'm expecting this, or I'm already in this, what should a 40-something-year-old woman be doing? What should be my first steps towards preparing my body for perimenopause, or reaching out to my providers, or what should I be advocating or asking or seeking for in these situations?
Sure. Since kind of really specializing in this area of menopause medicine, I think it's a great opportunity for women to really focus on themselves. I think for so long, we've been focusing on the people that depend on us, that are around us. And so I think it's a great opportunity to make a lot of changes for our health in a positive way. So really, I think number one thing that I really emphasize with patients I see is sleep. Sleep is huge. So I think really, I think up until this point where go, 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 we don't need that much sleep. We'll stay up late and finish something. We'll wake up early. But really, we need to prioritize sleep and make sure that we're at least trying to get, I think for the average woman, around 7 hours of sleep a night. So I think really prioritizing the wind down, the sleep hygiene, the ritual, because sleep is really going to, it's going to affect our mood the next day,
Yes.
our energy levels, our ability to cope with stress. It's going to affect our metabolism. So if there's one thing that I think women can really focus on is things like sleep. And I think other things that we should all be doing to kind of maintain a healthy lifestyle. I think it's a great time to look at our diets and making
Yes.
sure, especially for midlife women, we're emphasizing
Yes.
protein, fiber, whole foods, making sure we're eating, our green vegetables, avoiding as much as we can processed food, sugars, sugar substitutes. I mean, all this is just not going to make us feel good. Water, making sure we're drinking enough water, which I say for women, most of us, we should be at least 2 liters a day, if not more. And so I
Yes.
think kind of making these changes, as well as also a component of movement, exercise, walking is great. Also, midlife women, we need to start incorporating strength training. And I think up until
Yes.
this point, we've kind of been told we need to do cardio, we need to be thin, but we need to change our mindset and now really focus on building muscle, building our bone density, because we want to be strong, we want to be thriving, we want to be functional as we age. And so I think first and foremost, just kind of focusing on our lifestyle. I kind of even attribute it to like when you're pregnant. I feel like when women are pregnant, we really need to take care of ourselves. We're growing a human. And so I really think perimenopause and menopause is a great another check-in point. Be like, okay, we really need to
care of
focus on ourselves
Yes.
and make sure that we're doing all of these steps. And I think just having the awareness and knowledge to pay attention to changes that are happening in our body. So kind of, start tracking your periods if you haven't been to see if there's any changes. And even, I think it's easier nowadays with smartphones. There's all these apps,
Yes.
kind of start journaling some of your symptoms. Like, when are you getting hot flashes or night sweats? Or when are you experiencing mood changes? Is there a pattern? Is it cyclical at all? So I think that's some great first steps. And then, when symptoms do kind of get moderate to severe or they're impacting your day-to-day, your relationships, your job, then I think it's time to really bring it up to, one of your providers because there are options.
Yes. Do you guys see why I adore Dr. Patel? She just brought back intentional living without even saying the word intentional living. She started with sleep, then she went to nutrition, she went to movement, she went to inner alignment, she went to the positive social connection. She just brought it all together in a very practical way, taking care of your body, because we have been focusing on taking care of everybody else but us.
Absolutely.
So it's time to stop and take a listen to our own bodies. I think this is, with this, you see how she started. When I said, what are we talking about menopause? And, when I said, what can we do? She didn't jump first to prescription. She has not talked about prescriptions up until now. But I know that we have all the tools, with her being the physician that we look up to. She's got all the tools. So I'm going to make the most of the time that we have with you. And I'm going to go into some of the tools. In addition to all the basic things, we've addressed the pillars. We're talking about nutrition, putting nutrient-dense foods on our plate, movement, building muscle and inner alignment, sleeping so that our body is well-rested, restorative sleep for the next day. I know that there's a lot of, at Power Pharmacy, we're looking to start compounding hormone replacement therapy. And I want to take one step back. What is hormone replacement therapy? For people who don't even know what HRT is, what is hormone replacement therapy? School us. Tell us all the things.
Sure. So,
Yes.
when we talk about hormone replacement therapy,
Yes.
we're really talking about the hormones that our ovaries, used to produce in an abundant, predictable, cyclical amount when we were in our 20s and 30s. So
Yes.
we're talking, I think the main player that most people have heard about is estrogen.
Yes.
But there is also progesterone, and then there's also testosterone. So
Okay.
testosterone is not just a male hormone. We women, we also produce testosterone. So it's all
Yes.
these 3 hormones that we're talking about. And not every woman needs every hormone replaced or hormones replaced if they choose not to, or if medically it's not deemed safe for them to. But these are the kind of like the 3 major players that our ovaries, like I said, were once producing. And now that we're in that menopause transition or we're in menopause, the production has greatly decreased.
Declined. So as a younger woman, my body is producing all these hormones, estrogen, progesterone, testosterone, and all this. So as an OBGYN, what you do is you measure my levels of these hormones, and then you determine if I need to replace them. Is that what hormone replacement therapy is?
So yeah, hormone replacement therapy, there's different ways to do it. So when I'm seeing a patient, it's,
Yes.
it's very individualized to the person in front of me, because what's going to work for her isn't going to work for her sister or her neighbor or her
Yes.
work colleague. And so really, there's different ways to tackle it. And so, first and foremost, I just kind of want to get a sense of what symptoms the women is experiencing, what's going on with their periods, and then we kind of make a plan for that. So it may
Yes.
involve blood work, it may not. We may do trial and error. And honestly, for all women, there's so many choices when it comes to hormone replacement therapy that sometimes it is trial and error to finding what's the right way, what's the right dose. Sometimes, yes, we use lab work to help determine dosing, or if
Yes.
things aren't going the way that we think they should be
Yes.
with replacement. So it is very, like I said, very
Individual.
individualized. And then we also take into consideration, what other medical history somebody has, because it's going to
Yes.
be different if you have high blood pressure or diabetes or cholesterol versus if you don't maybe have some of those conditions, or you may
Yes.
have something else. And so it is not a one size fits all. And so,
I
like
love
I said,
that.
it is very, what are you going through? What is your health history? What's going on with your periods? And we can kind of make a plan from there.
I love that. I love that. And that way you get a good sense of helping that person who is in front of you at that
Correct.
point. Because I love that when I had a friend who saw you and she called me crying afterwards. And she said, Emla, thank you. And I was like, I didn't do anything. And she said, because she said, nobody has ever listened to me that well. She said, no doctor has ever listened to her and just taken care of her the way. And she goes, oh my gosh, the amount of time she spent with me, she took care of she literally listened to me. I felt like I was talking with a sister. And it made my heart really happy. And I just love the way you practice. And knowing that, listening to her, and she had a few other things going on, and cardiovascular risk and cancer in the past and things like that. So it enlightens us, and this is how medicine should be practiced. When we think about hormone replacement therapy, we think, yes, it's good, but it's for some people and not for everybody. Who should not have hormone replacement therapy? Like what are the risks associated with hormone replacement therapy?
Sure.
Yes.
So there are some people where we take pause, or where we feel like maybe it's not the best idea to start hormone
Yes.
replacement therapy. And honestly, I will say probably for most women,
Yes.
the benefits are going to outweigh the risks. So for most women, they're going to be a great candidate if they are interested and if they are suffering moderate to severe symptoms. And again, it's not an absolute, but again, we kind of have to look at
Case
risk
by
factors,
case.
look at history, talk about the different ways that you can take hormones. But in general, I would say we need more information, and we may have to, take pause of that at first.
I really love the way you explained how to initiate and what we think about hormone replacement therapy. And, I always love that you are able to explain things in such a way that somebody that doesn't even have a high school diploma will understand what you're talking about with all your medical knowledge. When you talk, you don't throw out medical jargon. You're like, Emla, let me explain this to you the way you're going to get it, or the way anybody is going to get it. So what are the benefits of hormone replacement therapy?
Sure. So, number one, the main reason we do hormone replacement therapy is really to improve moderate to severe symptoms and really improve your quality of life.
Yes.
So, if you're having, I've seen women who've had, hot flashes multiple times an hour, every hour, multiple times at night. They're waking up 2-3 times soaked from a night sweat. So anybody with moderate to significant symptoms that are impacting their day-to-day and their quality of life, and truly that's in the eye of the beholder. So really it's going
Yes.
to be up to you to
Yes.
tell me how it is impacting you.
Yes.
So that is number one benefit, is that it's going to make you feel better. And like I said, it can be anything from hot flashes, night sweats, mood swings, energy levels, helping with sleep.
Yes.
So those are the benefits initially. And we also know there's a lot of information out there as far as also health benefits
Yes.
from specifically estrogen replacement therapy.
Exactly.
So
Tell us.
one we know is that if you do start hormone replacement therapy within the first 10 years of menopause, so kind of figuring out when was that final period and going forward a year, if you start within the first 10 years, we do know that there can be some heart benefits. So meaning it can help reduce your risk of cardiovascular disease.
Yes.
And, another kind of misconception out there is that, breast cancer is the number one cause of death for women. It isn't. It's heart disease.
It's
So
heart disease.
heart disease is the leading cause of death for women. It is, in fact, more than all the cancers that affect women combined. So all the cancers that affect us, plus deaths from accidents, plus deaths from HIV/AIDS, and heart disease outranks it all. So
I just hold that thought right there.
Yeah.
I need you to say that again because we were just talking about this a few weeks ago. The number one cause for death in women is heart disease. So when people, because somebody said, Emma, your newsletters are kind of geared towards cardiovascular disease, almost every one of them. Why is that so? That is the reason. You heard Dr. Patel say it.
Yes.
Can you just say that one more time for us
Absolutely,
too?
yes.
I just want people to know that if we are working on something, we want to prioritize where we're spending our effort, time, energy to care for our health as women. We should be thinking about cardiovascular benefits.
Correct. Absolutely. And that's where all the other pillars come into play. Sleep, nutrition, movement. That's also going to help our heart health. And like I said, with hormone replacement therapy, if started within the first 10 years of menopause, can help reduce your risk of, things like heart attacks, heart failure, coronary artery disease. And again, yes, heart disease, number one cause of death for women. So
It
really
just gets
important.
me thinking. Yeah,
Yes.
it just gets me thinking because like estrogen, cardioprotective, as estrogen levels are declining, and then it's working against us, so we need to proactively.
Yes. Yes. So really that's where, the high protein, high fiber, lean sources of protein,
Yes.
our chicken breast, ground turkey, seafood, or,
Yes.
things like lentils, beans, like just great heart healthy sources of protein is where we need to be focusing.
If somebody just tuned in, they would think I'm talking with a dietitian. This is Dr. Pragna Patel, a board-certified OBGYN. And but it's just, I can't stress how important nutrition, movement, inner alignment, and positive social connections affect our activities of daily living. She talked about, the benefits of hormone replacement therapy. There have been studies out there, and people quote studies about how bad HRT could be for you. So what are the risks of it? Benefits and risks. Yeah.
Sure. And if I could, I want to talk about one other benefit that I think is huge for women and hormone replacement therapy that I think is often overlooked, and that is our bone health. So estrogen also can help prevent osteoporosis. And so I think this is not on a lot of women's radar because honestly, we don't. Right now, the current guidelines are that we screen average risk women for osteoporosis at the age of 65.
That's what I was going to ask. So nobody's going to measure my bone density until I celebrate my 65th birthday.
Right. And so, I have a personal different take on it. And so, there are risk factors, things like being thin, Caucasian race, maybe thyroid disease, maybe some of your medications. And so I kind of really look for ways to see if we can get a bone density sooner. I think a great time personally is probably
love Dr. Patel. I just had to say, I love you for that. Because, when you're saying this, and all that's coming to my mind is that, I read the statistics is that 1 in 2 women will have a broken bone from osteoporosis. One in 2 women will have a broken bone after the age of 65. That's scary.
That is.
I don't want to be the other woman.
Right.
I don't want to be. I don't want you to be the other woman. What can we do to be the other woman? And what can we do to change that statistic?
Yes.
What can we do?
So, I think a great time to get a bone density, I have women ask me that all the time. And you know what? A lot of insurance companies do cover a bone density. So if you're
earlier than 65?
Earlier than 65, I've been getting it covered. If you have one of those risk factors, then we can say, you're at high risk for osteoporosis. Or sometimes some insurances will cover it as screening, even at the time of the menopause transition, because I think knowledge is power. And if you're,
please.
osteopenic, meaning your bones are showing signs of weakening, but you don't have full-blown osteoporosis, I think that can really guide us and make meaningful change. If we wait until we're 65 to really work on calcium and vitamin D and work on weight-bearing exercise, really, I think that's too late.
It's too late.
But if somebody knows in their early to mid-50s that my bones may be a little weak, then yes, we can make some meaningful, effective change now. And I think, hormone replacement therapy does carry that FDA approved indication for the prevention of osteoporosis.
I love that.
And
I love
so,
that.
and I think we don't have it on our radar. And, the statistics are that for every woman that dies from a complication of osteoporosis, so does a woman of breast cancer. So when we get it talk about the risks of hormone replacement therapy, most people have heard about this breast cancer piece. But for every woman that dies of breast cancer, so does a woman from a complication of osteoporosis. So
And how
it's
simple is that to prevent?
correct.
Oh my goodness. Like that just hit me. You saying that, and I'm sitting, we don't want to wait until I turn 65 and you're like, oh my gosh, Emma, time for your 65th wellness visit, let's, do your bone density scan. Oh my goodness, you're osteopenic or your osteoporosis. Here's some Fosamax, take this and start taking, what happened 30 years ago? Could you tell me about, increasing my vitamin D levels, my calcium levels,
Yes.
my strength training, building muscle to support and things like
Yes.
that when I started menopause. And it's just be aware, people. Listen to your body and have these talks with your provider. Like
Yes.
I'm just happy that you brought that up because we would have overlooked that.
Yes.
The benefits of hormone replacement therapy for osteoporosis prevention.
Yes.
And this is one of the rare cases where, being physically fit is at risk. Women of smaller frame
Correct.
are higher risk for osteoporosis.
Yes.
So, and being Caucasian, that's also
Yes.
higher risk,
Yes.
and so it's just all the things. And there's always risk factor associated, but we talk about hormone replacement therapy, the benefits that can come to us. And let's talk about the women who cannot do hormone replacement therapy.
Yeah. So I would say that's where we go to our toolbox and pull out some other tools.
I love when she says toolbox.
Yes, I love that analogy. And so that's where we really need to maximize, again, the sleep, the nutrition, the
Yes.
movement, the hydration.
Yes.
And then we do have, I think I think all women need to do that.
Yes.
And then if hormone replacement therapy is not the best tool for you at a particular moment, we do have non-hormonal options.
Thank you.
And in that case, we're really looking at, what particular symptoms are we trying to target? So, for example, hot flashes and night sweats are common and
Yes.
bothersome symptom for women. There is a menopausal medicine that has been out for a few years now. It's
Yes.
called Veoza. It works at the level of our brain.
Yes.
And it can help reduce the intensity and frequency of hot flashes and night sweats. And
Yes.
when it helps with night sweats, it can help with sleep. So then we're
Lovely.
really looking at other medications. So there
Yes.
are certain antidepressants and anti-anxiety meds given at lower doses
Yes.
can help with hot flashes and night sweats. And if you do have any mood symptoms as part of your menopausal symptoms, then you kind of get a 2-for-1 bonus there.
Yeah.
If sleep is an issue, then we're really looking at how do we prioritize sleep? We're looking at, the wind down, the sleep hygiene. Do you need a sleep study? Because
Yes.
menopausal women are at risk for sleep apnea. And if you do have sleep apnea, that also is going to impact your
Cardiovascular
heart.
risk. Oh my goodness.
So then
it's
we're
all
kind of-
connected, isn't it?
It is. And so sometimes we may need to look at, medication options for sleep. So then we're kind of, when I have somebody in front of me who hormone replacement therapy is not a good option for them, then I'm kind of looking at what symptoms are you experiencing? What are your top concerns and what can we
Yes.
do to address each of those symptoms? And so, like I said, there are options. So just because you can't do hormone replacement therapy, there are other things that we can lean into. And again, the lifestyle, that's going to be for everybody. And you'd be surprised. I've had some women who've done a lot of lifestyle work before they come and see me. And
Yes.
they will say that they have felt improvement. It may not be the
Lovely.
whole picture, but yes, they have seen improvements with things like hot flashes and mood and sleep. So these things do work. And so we really need to make sure we're emphasizing that as well.
I love that. I love the fact that your practice, you incorporate, my mantra, which is in addition to, not instead of. So we're
Correct.
looking at, what else can we do? What can we do in addition to? And we're looking at options. We're looking at supplements, because
Yes.
up until now, there have been lots of supplements that we can add based on your symptoms. The stuff like you just mentioned, the calcium and vitamin D. We need to know our vitamin D levels.
Yes, we
Those
do.
are helpful. We want to make sure that, and I will always plug it in there, to be my friend, your vitamin D levels has to be above 70. I know that guidelines say 30 to 100 is the range, the required range for vitamin D. But to be my friend, and because I don't want to have to come take care of you with a broken bone, your vitamin D levels have to be 70 and above. So everybody listening to this podcast, go back to my chart, take a look at your vitamin D levels when it was last measured. Make sure your vitamin D levels are up to 70. If they're not 70, come see me, and we're going to take care of that because we have to reestablish our friendship. Do you approve of that, Dr. Patel?
I do. I'm glad to hear that number from you, because I tell most people, I like it between 50 to 70. So I like that you're pushing that 70. So, and I think
I'm pushing it for 70 because think about it. It's like I always say, it's like sending your child to school and saying, "Oh, baby girl, go to school, get anywhere from an E to an A." We'll be fine with that. No, I'm not fine with an E. Why are you going to school when you could get an A? Because I look at it that if your vitamin D is 31, you fall within the green.
correct, you
Right?
do. Yes.
Are you getting cardioprotective benefits from vitamin D? Are you getting the osteoporosis prevention benefits of vitamin D? Are you getting that? You're not getting quite as much.
Correct.
The mood benefits, the immune boosting benefits of vitamin D. There's studies that showing that vitamin D helps with telomere length. I just feel like we can optimize. So to me, I feel like this is my personal, and this is not a guideline. Again, this is an EMLA thing. And I think EMLA says, to be my friend, your vitamin D levels have to be about 70. So I think that's where it is. And that's where I'll leave it. Because we need to help each other. Women need to help each other prevent osteoporosis. I mean, that's a line.
Yes, absolutely. We don't want to be in the nursing home and never get out.
No, we don't. We don't
Yes.
want to have a broken bone, and then from there we have pneumonia, and then we go up to that. We
Yes.
have all these preventive things that we could do. Well, Dr. Patel, it has been amazing having you on here, and I don't even know how to express myself, because this is I'm so excited about this because knowledge is power.
Yes.
I mean, you said that knowledge is power. As women, we don't want to sit and wait. We want to get out there, be proactive. What would you advise the average woman to do today regarding being proactive about their health during perimenopause and menopause?
Yes. So I think, a lot of what we talked about in this podcast,
Yes.
number one, I would say sleep is huge. If there's only
Yes.
one, and when I see patients, it's a lot to try and do too
Rectify
many
in
things
one
at once.
visit.
And so, it's overwhelming to think about, I need to have this many grams of protein and I need to do strength training 2 to 3 times a week. So I'm like, we're going to
Yes.
focus on one thing, because this is
Yes.
going to be something that, we
Lifelong.
work on
Yes.
over a period of time, 3, 6 months, 9 months, a year, and to come. And so I think if there's one thing that we can focus on is I would do anything and everything to prioritize sleep, because I think
Yes.
that's really going to spill over into a lot of things. But if you feel like you got sleep down, then I would say, pick something else that that you're not the best at. So maybe your goal should be, I'm going to try and get to 2 liters of water a day and start tracking it. Or I'm going to work on getting 120 grams of protein a day. And so I would pick one thing. And once you kind of pick that, then we're going to build on that. And that's something that, I kind of help guide women through when I see them,
Yes.
because it is overwhelming to think that, oh my gosh, I need to make all of these
All the
changes.
changes.
And then I think we need to make all of these changes all at once. But in order to be successful, we need to focus on one thing at a time and baby steps. So,
Yes. I
if-
love that.
So just to kind of make it manageable, and over a period of time, everything will sort of come together. So
I love the way you put it. I love,
that would
baby
be
steps,
Yes. If you've never lifted a weight in your life, I'm not expecting you to start going to the gym 3 times a week. We're going to
Yes.
commit to one day
Yes.
of something small. It could even be 20 minutes, because
Yes.
some movement is better than no movement. So we're really
I love
going
that.
to start small,
Yes.
celebrate those wins, and we're going to build from there.
I love that mindset. I love that that's how we're going to approach it. And that's how we're going to make it sustainable, practical, and something that will be incorporated into our activities of daily living. So in this Intentional Living with Emla podcast, I love the fact that we focus on those pillars. You talked about sleep. We talked about nutrition. We talked about movement, inner alignment as those biomarkers will be aligned as we're doing all these things, and positive social connections. The positive social connection piece is that, here you want to share this podcast with people who you think that will benefit from this information. And that's literally every woman. Any woman in your life, all those friends, sisters, wives, share this podcast with them. And I know that I will be having more conversations with Dr. Patel in the future. And I have one more question for you.
Yes.
Before I let you go. What supplement is on your mind? Because what supplement is on your mind today is what we're going to do for Supplement School with Emla.
Sure. Well, I want to maintain my friendship with you, Emla. So the supplement that's on my mind right now is vitamin D. And once we get off the air, I'm going to look up my vitamin D and hope that we are still friends. And if not, I'm going to work on getting back into your friend group. If
I
I'm
love
not
that.
up at 70.
I love that. Yes. So I know that you're in my friend group. Yes. I know that already. Yes. Because I know your vitamin D levels. Yes. So, but let's talk about vitamin D because Dr. Patel has it on her mind today. So that on Supplement School with Emla, vitamin D is basically a hormone. Vitamin D is not just a vitamin, it's a hormone. So, but vitamin D, if you're taking vitamin D, here are the things that I want you to have in your mind. Your vitamin D should be vitamin D3. So make sure that you look on the back of the bottle. Your vitamin D should be as vitamin D3. And with that, we get vitamin D from the sun. So our body will make it when we're in the sun. But the problem is that where you live, you might not be getting out. If you, for example, if you live in Ohio, even if you get outside and walk naked for the whole day, you're not going to make as much vitamin D as somebody who is in Florida or somebody who is in the Caribbean islands. So above the 37 parallel, where the line that cuts on the 37 parallel, we'll put that in the show notes so you can see that. But if you live in some of these states, you want to make sure that you're taking vitamin D year round, not just in the fall and the winter. So, but vitamin D, typically, personally, this is what I do. I take vitamin D 5,000 IU, and I make sure that I take it with vitamin K2. Vitamin K2 helps your body not only absorb vitamin D, but it kind of helps direct where calcium goes in the body. Because you heard Dr. Patel talk about calcium in the body and, preventing osteoporosis and osteopenia. Calcium is necessary to strengthen our bones. But calcium can also deposit in the soft tissue. And we don't want calcium in the soft tissue. We don't want calcium in the soft tissue. When I talk about soft tissue, I'm thinking of the arteries. I'm thinking of the kidneys because little calcium deposits in the kidneys. Those are kidney stones. Nobody's got time for that. And little calcium depositing in our arteries. When she talked about coronary artery disease, when she talked about atherosclerosis, when she talked about plaque, we're talking about calcium accumulating in our arteries and cholesterol adding on there and all those risk factors adding. And then we have increased risk for cardiovascular disease. So we don't want that. So, but if we're taking calcium, we want to make sure that we're taking vitamin D3 with K2. And so Emla Naturals vitamin D3 has K2 with it, about 45 micrograms of K2, just to make sure that we're cleaning out the calcium that's in the arteries and making sure that it's blocking that pathway for calcium to go to the arteries and to the soft tissue so that vitamin D is calcium's BFF. They hold hands and they're going to the bones. And then K2 is preventing any little calcium that could have gone to the soft tissue. So, but the only people who cannot take the K2 are people who are on warfarin. So those are the things. That's why at Power Pharmacy, come to Power Pharmacy with all and schedule a comprehensive health review, and we're able to take care of all the medications that you're taking, your supplements, and making sure that you're taking the right supplements with the medications that you're taking and for your disease states. And just also your biomarkers. We're looking to enhance your vitamin D levels. But if you're on warfarin, I'm not going to give you K2 because there's a drug interaction there. So vitamin D levels optimal that will prevent you from prevent osteoporosis, osteopenia. That will also increase cardiovascular. That will reduce your cardiovascular risk. That will also improve immune function. That will also improve your mood. There's studies that show that people with higher levels of vitamin D do better with increased doses on SSRIs. So that's enough about vitamin D. And if you found this useful, which I'm really dearly hoping that you did, please share this podcast with other people in your life, other women. And I'm certain that we will have Dr. Patel again. Thank you very much for your time. And it was lovely having you.
Yes. Well, thank you for having me. This was great. I look forward to coming back because really I could go on for hours about any one of these topics pertaining to midlife women. It's really a passion of mine. So I'm looking forward to
I'm so happy.
more conversation and kind of really empowering the women that are listening.
I'm happy. And I think that that's really what we need to be doing. Thank you for listening and share this podcast with others. Be kind to your body.